Good afternoon, everyone, and welcome to our live chat session. Thank you all for joining us. Hope the weather's good where you are. As you know from these communications recently, the topic for today is bringing volunteers back on site and how to do that safely. So firstly, can it be done? Next, who's doing it successfully? And if so, what can they share with us? And what can we do in the network from Helpful to help you in bringing volunteers back? So 7 people have kindly reserved slots to share with us their updates and the progress they've made. So thank you to those people for stepping forward. It's going to be really interesting and helpful to hear from you. We'll go to each of our contributors in turn and invite questions after each person has given their update. So you can use the raise your hand function or the live or the chat box to post your questions if you prefer to do it that way. We are going to keep it tightly to time, so we're going to give 3 minutes for each speaker, including questions. So I hope we'll be able to get through everybody. If we don't get through all the questions, we'll hope to get answers for you and come back to you after the session. So for now, can I ask you all to mute yourselves, just so that it's nice and quiet for the people who are going to be speaking and for us all to hear properly. We're going to be recording the session. You've probably seen the message on your screen. So by joining, you've given
Sally, I think we've lost you there.
Okay.
Sorry everyone, I think we lost Sally there, so we're just gonna go straight now, if that's okay. Hope everyone can hear me well. Do put it in the chat box. So next, so the first speaker we have is Alan. Alan, are you there?
Okay, so I put together a handful of slides just for the session today. Bear with me 1 second. So the topic being bringing volunteers back safely. So where volunteering is in NHS Scotland across NHS boards is very, very different depending on the board and the local circumstance. So it's either remains to be paused entirely, or there's some limited roles, very limited roles such as gardening, or some other limited roles that might be acute based, such as wayfinding or in some wards. And then you have a handful of boards who are open to recruitment and have had volunteers in place since early during the lockdown period. And just to represent that visually, so typically we would have around 6,000 volunteers engaged at any given time. And the line at the bottom is showing a decrease since June there. So that's largely due to people returning to work, people who were furloughed and are returning to work. So you've got a couple of boards at the moment, the larger boards, looking to accelerate their recruitment programs in order to meet that need locally within their services for volunteers. We have today, so timing has been very, very opportune today, published shared practice and guidance on volunteer management in NHS Scotland in response to the COVID-19 pandemic. So in terms of the relevance for bringing volunteers back, we are recommending the use of the COVID-19 age tool, which we'll talk a little bit about on the next slide in case anyone's not familiar with that. There's other examples of practice in there and recommendations such as a phased return, either by services qualification or by volume of volunteers. Also suggesting staggering rotas, so you may decide to look at things like the incubation period for the virus and stagger rotas on a 14-day period or less because of the 14 days that lie in between the two attendances that volunteers would have. We need to refer to Health Protection Scotland guidance. I appreciate that won't apply elsewhere, but you will have your own local guidance. And that covers things like distancing, PPE, the specific requirements that are in place for transportation, etc. And just to be clear, not endorsing or suggesting that volunteers would be involved in transportation at this point in time. It covers face coverings and masks, obviously the local guidelines and restrictions on public transport, that type of thing, and the use of masks. And in terms of symptom reporting and contact tracing, really keen to hear what the approach is elsewhere in the UK over that, because I'm seeing a bit of resistance to the daily reporting or in advance of attendance. And just to use a bit of a benchmark, if you look at any of the sports that have been allowed a gradual return to play protocol, the attendees for practices and games do have to report 24 hours in advance of their attendance that they are symptom free or what their status is. So I'm just keen to hear how that's been applied in a volunteering context. And travel I've mentioned in terms of face masks, etc. So last thing I was just going to mention was a wee bit more detail about the COVID age tool. So this was produced by the Association of Local Authority Medical Advisors in the UK. It produces a COVID age. It takes into account risk factors such as age, ethnicity, various health conditions and sex. And it has a viral prevalence matrix attached to it. So that's, if you're familiar with risk management in these days, that's your risk appetite. So when the viral prevalence is high, you will see that it will acknowledge that in the resulting risk factors on the calculated age. And it does recommend clinical judgment. So obviously I'm not a clinician, but this is an evidence-based tool, and we have recommended that for use. So happy to take questions on any of that.
Thank you so much, Alan. Sally?
Can you hear me now, V?
Yes, I can hear you very well now.
Yeah, I've logged in again. Thank you, Alan, for that. Does anybody have any questions they'd like to put to Alan before we move on to the next speaker? You can use the raise your hand or the chat box. And if we've got time at the end, we can put them.
We've got Amanda here. We've got Mandy. Mandy, raise your hand. Would you like to unmute yourself and ask a question?
No, just ask a question, Alan. It's great that you've pulled this together, and it looks very clear. You seem to be. We seem to be a little bit further ahead than you for placing volunteers, and it will be interesting to see what other people think. Because we've got quite a few more roles, but it looks very well mapped out, and our risk assessment looks similar to yours as well. So I look forward to looking at the document in a bit more detail.
Just to add, so we don't advise on particular risk assessment within boards because each of them has that jurisdiction locally. So in the guidance, what we've done is we've included shared practice. So there are some examples of risk assessment for volunteers who are in place at present.
Great, thank you, Alan. Jill from Royal Free, you've got your hand raised. Would you like to ask Alan a question?
Hi there. Yes, I would. Can you hear me?
Yes, thank you.
Yeah, I'd like to know whether you have discussed young volunteers, whether you think that they need to be risk assessed, given that they might be at school or living with other young people, being out and about, because our young volunteers are quite scared to come back. They think that they may be a risk to the trust. But actually nobody's thought about them being high risk. We just talk about the over 70s and not the young volunteers, the under 22s.
It's not something, yeah, thanks for that. It's not something that I've faced a query about locally, so it may be something that some of the boards are looking at. But the tool in terms of risk, so what we advise is risk assess the role with COVID in mind and all the distancing, etc., that would be required. And we've also suggested in the guidance just to consider transport and how that might affect people. So obviously it ties in with the reporting of symptoms of being symptom free in advance. But as I say, I'm not a clinician, so would not be best placed to advise on the risk factors either to the people or them bring it in, other than just reinforcing the hygiene precautions that are necessary.
Thank you. Verity from Royal Cornwall, would you like to ask a question?
Hi, I just briefly like to address the last point that was raised from Royal Free, in that we've continued to have young volunteers with us since lockdown actually, and they have undergone the various risk assessments required by our trust and as advised by Public Health England. And yes, we have undertaken the latest COVID test, which Alan has mentioned, providing of the COVID age, and have of course ensured that they're wearing appropriate PPE. And our young volunteer coordinator, Patsy Dalby, has been keeping in close contact with them to ensure that they're both happy. And we speak to them after, we try and speak to them, well, we see them most times that they come in, just to ensure that they're happy and that they're confident. Yes, we have had some young volunteers who have come in and who have decided after one taster that it's not for them. But again, that can happen with our older volunteers, and we're just in the process now of utilising the COVID-19 tool to welcome back some of our older volunteers who will come in into the moderate category. So we find the risk assessment, as has been said, an extremely valuable tool for our continuing volunteer activity here on site and off site as well, because we risk assess our volunteers who are supporting us off site too. Hope that helps.
Great, thank you very much. I'm going to move on to our next speaker. Just want to say thank you to Alan. That was really concise and useful. Our next speaker is Mandy Cleaver from Sussex Community. We've heard briefly. Mandy, would you like to speak now?
Sorry, Sally, what was that question?
Mandy, I'm going to hand over to you now for your presentation.
Yep. Okay. Hi everybody. Hi everybody. I'm Mandy Cleaver from Sussex Community, a community trust. I just want to say, really, just to sort of reiterate, following on from Alan, then. I mean, my main thing that I would say to how we've approached it is really the risk assessment, and each of our every single volunteer that we've had has been individually risk assessed against their own health conditions and what their status is, and from that it was broken down into what volunteers could go forward, what volunteers were resting, what volunteers were fit and healthy to move forward. We identified from about a 460 volunteer workforce, we identified about 31% of those were at high risk and had to be asked to step down. And like Alan again identified, our volunteering numbers, again, as Mark Lever said, that have been decimated, and we've only got about 22% going forward. And those are, they've been in our COVID response roles, very much along line, the driving role around PPE delivery, donation, hub delivery, all very much COVID response roles. And we're only just now moving into starting to place volunteers back into services where those services have had their recovery. They're in their reset phase and they know what their clinical demand is. They know what they want. So we're probably working with about 30 or 40 different teams currently, and just starting to place volunteers back onto the wards and in what we would class as high risk roles. And so our risk assessments are very intricate. They're very detailed. It's been a huge piece of work, and I'm more than happy to share our document with you all. And it's been things like Verity's already mentioned that we've mitigated for, and also really it's responsibilities of the staff. So it's not, we're placing that volunteer there. We've got the risk mitigation, but we've got on some of the mitigation, we've got to rely on ward staff and doing their bit as well. So it's not just all about us, it's about the ward staff participating and being on board with volunteers going back into their workplace. So for example, we've decided as part of our mitigation that volunteers would have the choice to come and volunteer onto a ward. If there were COVID positive patients present, they would have that choice as to say, yes, I'm happy to come on. The patient is nursed in a side room and the volunteer wouldn't not be approaching. But we felt it was important that the volunteer should know. And so they have that choice. So we rely on the ward staff then to notify us or the volunteer to tell them that's the current status. We've actually just devised also a bit of a sort of SITREP daily monitoring that we've got on our generic calendar, our voluntary service generic calendar, all our live ward roles. So we know what volunteer is where across the trust in our bedded units. So if things were to change, if COVID positive patients, the numbers were to rise, we knew exactly who was where and we could immediately pull them off. So that's been quite a relief for me that I can see that live data and I don't have to rely so much on ward staff. So yes, so very intricate and detailed risk assessments for roles, and then the categories for our volunteers. Sorry, who's that phone call?
Sorry, who's that?
I'm not sure who that is.
I'm just gonna mute everyone on, and then Amanda, can you unmute yourself?
Is it stopped?
Yeah, that's stopped now. Yeah, Amanda. Yeah, can you?
So yes, so just I'm sure people are familiar with the categories that volunteers were put into. You know, our over 70s, our under 70s, and then our under 60s, going into high risk roles. I'm sure people are very similar with that. Also, opportunities for our over 70s who are fit and healthy to volunteer in a secure site which has no access to patients, and we're potentially looking at some of those healthy over 70-year-olds. Going back into patients' homes for befriending, and we're having further discussions with our public health consultant around that. So that's where we are, and I'm sure you know, it'd be interesting to hear from other trusts where they are. You know, it's around that volunteer being happy, they're wearing that full PPE. I was on the ward yesterday, trialing a role that we're trying to get up with our iPads and Skyping friends and family. And I put my full PPE on, and I was talking to the patients and imitating what the volunteers would be doing. And I think that's important, that we know what those volunteers are going through and we can support them. And of course, it must be their choice at the end of the day. So that's about a few little notes from me. I hope that's interesting and helpful for people.
Thank you, Mandy. It's really great to hear the progress that you're making at your trust. Really kind of invigorating and hopeful for the future. So thank you for that. And I'm sure people will be interested in your risk assessment document if you can have to share that. Thank you.
Yeah, I'll send it to you.
We don't have any questions at the moment, but we'll keep an eye on the chat box and perhaps put them to you shortly if that's okay. I'd like to move on to Debbie McEwen from South Tees now, who's next in line in the chair. Hi, Debbie, are you there?
Just give me a second. I have a feeling Debbie is not joining us today, I'm afraid.
Okay, no worries. Right, next to go is Jane Elliott from Sheffield Teaching Hospitals. Jane, hi, are you there?
Hello, yes, I am here. Can everybody hear me okay?
Yes, hi.
Thank you very much for letting me come and chat today. Yeah, at Sheffield Teaching Hospitals, we are a very large trust. So at the beginning of lockdown in March, we did stand down all the volunteers, apart from our pharmacy runners who were you know, important to the trust at that particular time, and they were the only volunteers that did that were active throughout lockdown. But then we later on looked at developing and writing a phase 3 return for our volunteers. So phase 1 we introduced about a couple of months ago, which were very low risk roles, you know, roles where there's no patient contact at all. So these were things like our hospital radio volunteers who are, you know, in a tower away from everything, so very low risk. We've now been working on our phase 2, so we've got more volunteers who have come in and are active in the trust. And our phase 2 roles are medium risk. So these are things like we had a drive through blood service down off-site down at our arena. So our volunteers have been helping with marshalling down there, and also an ophthalmology screening service. So very specific to the COVID situation. We've also had our our clothing project running as well, which is helping with providing clothes to our wards as well. So again, we're all classed as medium risk. We've risk assessed all the roles as we've gone forward. We're now looking at introducing some welcomes onto the sites as well, helping with face mask stations, making sure people are washing their hands, but also helping in the next couple of weeks when the flu hub starts. Apologies. They will be helping with the flu hubs as well. So fetching vaccinations, making sure that temperatures are right in the fridges, all those sorts of jobs as well. So for our volunteers as well, we go through an individual risk assessment with each returning volunteer. We assess them as Mandy has done about their health, you know, what situation they're in at that particular time, what age are they. So we know that anyone, even over 70, can come back to our medium risk roles if they choose. It is very much a choice. We did a consultation with our volunteers as well before we started all this to find out how people felt at that particular time. Did they want to return? Did they want to wait? And we had quite a mixed response. At the moment, we know we'll have about 76 volunteers returning out of our 450. Quite a lot of volunteers have said they just want to wait until the situation improves. Some just want to wait till the normal roles are back to normal. Our phase 3, our phase 3 return is our clinical areas, so wards, etc. We know because we have to have approval from the trust board that we won't get approval for phase 3 at this stage. We were going to go for this in October, but because of recent situations that they've changed, you know, the infection rates are going up. The trust have decided that won't go ahead. So we think now that phase 3 won't happen this year. We can't see that we'll be able to return any volunteers on towards until next year. If things change, then we will look at it again. So that's where we are at the moment at Sheffield. It is a very ongoing situation, changes weekly. Other roles do come up and we think, right, we can do this now. You know, a lot of virtual roles as well, sort of phoning patients, that sort of thing that we've got going on with some of our voluntary partnerships as well that work with the trust.
That's great. Thank you, Jane. Really helpful and really helpful structure for us all to follow with the 3 phases. That's very useful. So thank you for that.
Yeah, it's worked really well for us up to now. You know, it's just that we broke it down. We thought it'd be a lot easier breaking it down into the different risk categories, so we can see who we can bring back. As you say, we've got this situation with over 70s. We know we can't offer them ward roles, but we thought, well, are there other roles that we can offer them that we know they're going to be safe? The other thing that was interesting as well, that we found that some of our volunteers, especially our more mature volunteers, it's actually explaining to them about the PPE. Now, the other thing I've not mentioned, we do briefing sessions with our volunteers as well, which includes all the changes in the hospital around PPE. And it's actually explaining to them that they will have to wear a face mask or some form of PPE whilst they're in the hospital. And some of the volunteers have actually turned around and said, I can't do that. You know, it's not possible. I can't wear a mask for 2-3 hours at a time. So that was very interesting to find that out, that people just thought they could come back as normal, you know, and it wasn't the case. So yeah, very interesting.
Great, thank you. Jill from Royal Free has asked a question. Are any of the screening volunteers allowed to take temperatures of patients? Is that part of the role?
For the ophthalmology, no, it's not that sort of screening, I understand. We don't have any volunteers taking temperatures. That may change, but at the moment, no, that doesn't happen.
That's great. Thank you. Oh, Mandy's replied she's asked about this, taking temperatures is not compulsory,
Yeah.
but would be considered if it became compulsory. So that's really helpful. Thank you so much, Jane, for your contribution.
Thank you.
And we move on to Martina from across the water at Belfast. Hi, Martina, are you there?
Martina, do you want to unmute yourself? I think Martina is having a problem with her connection. Probably have to move on now, Sally.
Yeah, okay. Perhaps we can move on to Nancy from Barts. Nancy, are you there?
Yeah, I can't hear Nancy either. I'm afraid she might not be on actually.
Okay. And Jill Reynolds from East Sussex. Jill, are you there today?
Yes, I'm here.
Hello, Jill.
Hello.
Nice to hear from you.
Hi, can everybody hear me okay?
Yes, thank you.
Great. Okay, so I'll just give you, I don't have any slides, but I'm just going to give you a quick context about us. East Sussex Healthcare NHS Trust. We have 2 acute hospitals, one in Eastbourne, one in Hastings, and a few community hospitals, Bexhill and Rye. And we had around 500 volunteers plus around March time active. We stood them all down by the end of March, but we had some new opportunities and roles coming forward, which included roles in pathology, which was mainly taken up by younger people. As also pharmacy drivers, and a wonderful new role that we've retained, which is a discharge check-in service, phone service for our discharged patients once they're home within the first 2 days. And since June, we've had what we've called safety station champions on both hospital sites at the entrances, initially asking people to use the hand gel and put on masks, but that's evolving into a meet and greet role right now. So the next thing is getting our volunteers back, and we had the green light to go 2 weeks ago from our director of nursing to say it's okay to bring our volunteers back onto the wards and into departments. So we've got a procedure for that. And I agree with previous speakers, Mandy, you know, it's the choice of staff. It's the choice of volunteers. So we've got a procedure which allows for choice and managing expectations of both staff and volunteers. So I sent an email with our procedure to all our wards and departments a couple of weeks ago saying, if you'd like your volunteer back, let us know. If you'd like a new volunteer, let us know. And we then are liaising with that ward or department with our new role description for volunteers, which includes a section called Your Safety and Protection. So that includes the PPE, and that's bespoke to the ward, bespoke to the department, bespoke to the role. Once that's completed, we would then volunteers to come back and have a trial, again, see how it feels, and also an opportunity for the staff to say, has that worked for both parties, and then move forward. We're in the very early stages of this, and interestingly, we haven't had a huge response from the wards. Mainly we've had a frailty ward, ophthalmology, and where else? Just a handful of wards, not that many. And so we're proceeding with caution. The other thing that we've got in place around risk assessments is that it's up to the ward or department to have done their own risk assessment for the environment on our Assure system. But also all our volunteers are getting a risk assessment. Every single one, every active one has a risk assessment using our online staff risk assessment procedure, and all new volunteers coming in. Something that we haven't tackled yet, but I do anticipate when somebody presents as a high risk, what we do. And I would say we would need to handle that person very sensitively about, you know, recognizing it would be about a conversation with them about maybe not at this time, but if we're going to take that one if for each individual, and recognizing that there's a lot of our volunteers who are desperate to return, but there may be not the place for them to return, or they may not be able to return because they are actually presenting as high risk. I think that's what I want to say for now.
Brilliant, thanks, Jill. Just a couple of questions. Kim from Dorset is asking if you could give some information about the discharge check-in service. I wondered, do you have anything that you could share?
Yes, certainly. I have shared it before, but I'm very happy to share after this meeting. There's the template for our role description template, which I think is I just revised it again this morning. It's constantly reviewed to ensure that it actually is fit for purpose and is up to date with latest changes. I mean, one aspect of that role description is that we would expect to for reorientation of the hospital, because the layout's different, wards have changed. It's very, there are a lot of changes for volunteers coming back. Regarding the discharge check-in role, that's a phone call to our discharged patients on the zero pathway, which means that they don't necessarily have any ongoing health conditions that we need to be, sensitive to. For example, they're not linked into other social care, healthcare services in the community. However, we do recognise a lot of people are going back to live alone at home alone, and they may not have the right support in place. We may not be aware of that. So those check-in phone calls, initial phone calls, are finding out their experience of our discharge process, their experience of being in the hospital, and do they need any ongoing support. And I just want to add to that we've got we're working collaboratively in partnership with our local Health Watch service, and their volunteers are doing a further follow-up call at least a week to 2 weeks later, because we recognise once someone's at home and maybe a week later or so, that they realise they actually do need more support. They do need to be linked into befriending services and that sort of thing. And that this service, using our volunteers in this way, is going to continue. And right now I'm looking at other ways we can bring our volunteers into the hospital to support patients pre-discharge as well. Yeah.
Great, thank you, Jill. Jane from Sheffield, you've got your hand up. Would you like to ask your question?
Yeah, of course. That's really interesting, Jill. It's interesting to hear how people are progressing with the ward volunteering. It wasn't really a question. It was just to say that we've had a different response here at Sheffield, because from our wards, they really said we don't want any more footfall.
Right. Yeah.
It is about how many people are coming on and off the wards.
Yeah.
So they've got restricted visiting now, so it's got to be a nominated person. So they said they can't really accommodate volunteers as well, even though they'd love that help again, and our volunteers would love to return. It is about that footfall. So we've sort of backed off now and said, well, okay, we know we're not going to get that approval. But it is very interesting, and it's great that some trusts are able to take that forward, because I know it's so important. Yeah, definitely. Thank you.
Thanks, Jane.
Yeah, I think I just want to just reiterate what's been said previously. It's very much about choice, and the procedure I've put in place is very much about the ward can choose, and if they're to have an informal meet with the volunteer prior to coming back, and we've also advised them that they can say no if that volunteer isn't the right fit, or they've got any concerns. Their choice is very much with the ward at this time. So yeah, and it's very new to us, because this is we pre-COVID we didn't actually have as many volunteers on our wards as there could have been. So it's a very slow moving process for us.
Great, thank you, Jill. I must apologise that nobody can see me, but my camera's not working. It's probably to do with my internet connection, so I'm not being antisocial. But thank you, Jill, for updating us on your progress. Really, really good ideas coming out there, and yeah, fantastic.
Yeah.
So as you will know from these emails and reminders, we're going to try something different today. So at the end of this session, we're going to have a virtual coffee breakout room session. A few people have asked to be involved in that, and Vi will organise the breakout rooms at the end. But obviously, if you haven't asked to be included in that, then you're free to leave the call after the next few reminders that I'm going to talk to you about. So just to let you know what's going to be happening later. So if you are involved in the breakout rooms, please give your feedback afterwards, because we'd love to know whether you would like this to continue as a regular thing. So before we start the networking, I have a few reminders. You probably know that our new Connect website has launched today. We hope you've had a chance to have a look around, or that you will do in the near future. You should find it much easier now to share your knowledge and connect with colleagues. And I think we're going to put the link to the site in the chat box so that you can access it easily. If when you've tried Connect, if you want to come to a session on the 14th of October, we're going to be here to answer any questions and to help you get the best from the Connect site. And we'll update the details on the events page for that. Now that the second wave, or the progression of COVID is happening, if you have questions and issues that you'd like help with and you think that the network might be able to assist, please use the Connect forum to have a chat and ask for help from your colleagues. That's what it's there for, and it is a dedicated space specifically for that. So hope that you'll find that useful. Another thing that's happening, we're really excited. We're going to soon be able to share with you the results from our Volunteering Innovators programme. We'll be launching the Impact Report at an online event on Thursday, the 22nd of October. Of course, you're all invited, so look out for the invitations coming through, but you'll also be able to see the details on the events page on the Connect website. So hope to see you online at that event so that we can share the good news with you. Now Mark Lever, our CEO, is online. Hi Mark. I think Mark wants to just say a couple of things to you while we've got you all here. So over to you, Mark. Thanks for joining us. Mark, are you there? It's not just me having gremlins today.
Yeah, I think Max probably has problem connections as well. Very sorry, everyone. Yeah, I think we have to end the session here today then, I guess. If you don't have any other questions for other speakers.
Jill has put a question in the chat box. Now, I'm not sure who this is to. Do all your new roles need to be cleared by an infection control panel in the trust? Is that to Jill Reynolds?
Yeah. Well, to anybody really. Because
okay.
Can I just say, sorry to interrupt, but because we've been doing really well. We've had all our infection control, all our risk assessments done. We've got supervisors on the wards that have signed everything off. The wards want the volunteers back. Some of them want to come back. They've been risk assessed. But the infection control panel of the hospital meet every week, and they've just done a complete U-turn and said they don't want any of them back for now.
Wow.
And when last week they said they said that we could have dementia volunteers back, dementia companions, but then because of the figures rising, they've now said they've changed their mind, and I've got a meeting with them at 2 this afternoon to explain why. But I just wondered if the rest of you had to go through all these panels.
I know, but I'm very interested to hear that, because I know things change all the time, so I do have to anticipate. We do have to anticipate that the acceptance to have volunteers back on the wards may suddenly be. We might suddenly say no more. We can't. We've got to take them off, remove. And infection control, I'm wanting more bespoke training for our volunteers around infection control, because currently there's nothing really in place substantial which needs to happen. That's where we're at within the trust at the moment.
Okay,
thank
thanks.
you, Jill. Yeah, and Jane was just confirming at Sheffield they did need approval from infection control, so it seems to be quite consistent. I think Mark's managed to join us. Mark, are you there?
I hope, can you hear me now, Sally?
Yes, we can, thank you.
Oh, very good. Technology. Hi everyone. Great to see everybody, and great to see everybody sharing such really good ideas and constructive support. One of the things that we've been really concerned about, and I suppose a few people have highlighted that, is the fact that there's such a drop off of volunteers within some trusts, and a sense that some of the leadership within the trusts aren't giving volunteering the attention it necessarily deserves, when we know there's going to be a real challenge ahead. And we know that should there be another spike with COVID, that there won't be the same level of internal staff relocation, because hospitals are going to try and keep everything working at the same time as running their COVID wards. So volunteers are going to be needed more than ever. We're hoping that when you see the evidence that's going to be presented from the Volunteer Innovators Programme that Sally spoke about, that's going to help you develop a much stronger leadership case for the powers that be within your trust to demonstrate the impact of volunteering. But we're also going to be putting a call out at that time for any trusts who are interested in working with us in groups on tackling particular challenges that your trusts have at a leadership level. So where trusts have particular challenges and you think volunteering could be part of the solution, we're going to be really keen to try and bring like-minded trusts together in smaller groups to work together to develop new volunteering interventions that we can help you evaluate and share the evidence of the impact of those with your leadership to hopefully increase the investment in volunteering. So look out for that. We're likely to put the call out towards the end of October after we've released the VIP results, but I just thought I'd trail it there, Sally.
Great, thanks, Mark. Okay, this is a nice conversation building up in the chat box. I hope you're all managing to follow that and put your answers in there if you get the opportunity. I think now we're going to go to our new networking session. So for anyone who's actually put themselves forward who'd like to be involved in that, are we going to go ahead with the breakout rooms?
Yeah, that's right. People with them who sign up already got emails with the details to join the breakout room. So please just use that email and join now. Yeah, and then for the rest of you, have a good afternoon.
Thank you all for joining us. Hope you found it useful. It's been really great to hear the sharing that's going on. Very much appreciated, and we hope everybody has found that helpful. So hope to see you online soon. We've got 2 virtual check-ins next week, and we'll send reminders round. And of course, you can have a look on Connect and see them on there as well. So many thanks, and hope to see you soon.